the fall, how it ends. It's the fall, how it ends. Or it's the fall, how we rise again. Ooh.
Hello, and welcome to yet another PhysioTV classroom session. I am Dr. Gondhali, and I am Assistant Professor in Cardiovascular and Respiratory Physiotherapy in Sancheti Institute for Orthopaedics and Rehabilitation, College of Physiotherapy. So in today's topic, we are going to talk about meter dose inhaler. The objectives for today's classroom lecture will be introduction to meter dose inhaler, and then I will be talking a little about the principles of working for the meter dose inhaler or MDI and its advantages and disadvantages along with its types and what are the kind of formulations that are used for the MDI and the factors affecting the performance and drug delivery along with the methods of use. So meter dose inhaler is a type of aerosol therapy which uses a combination of drugs that are dispensed via a metered valve at multiple doses. So metered dose inhalers were first developed by Dr. George Mason in 1955, and these are commonly prescribed in patients with COPD and asthma. Moving on to the mechanisms of aerosol deposition. So the drug particles, that is the aerosols, which are pushed out from the meter dose inhaler, are deposited into the lungs or the alveoli through inertial impaction, gravitational sedimentation, and diffusion. So talking about inertial impaction, it means that the amount of force that will be generated by the meter dose is going to help propel the formulation into the bronchi and then to the alveoli. So the larger particles, which are more than 3 micrometers and which are fast moving, are generally propelled out of the MDI by the principle of inertial impaction. Talking about gravitational sedimentation, gravitational sedimentation depends on the mass and time. So basically, the mass and time of the formulation of the medication is directly proportional to the sedimentation that will occur due to gravity. And then talking about diffusion, diffusion occurs in particles which are smaller than 1 micrometers. And the large particles, which are greater than or larger than 10 micrometers, are filtered out in the nose when taken through the nasal passage, while they are filtered out through oropharynx if taken by mouth through the meter dose inhaler. And 5 to 10 micrometers of particle size is often reaching the proximal generations of the branches of the bronchi, whereas 1 to 5 micrometers reach the lung periphery. Now, coming to the advantages of using meter dose inhaler. First of all, as we can see here, this is a meter dose inhaler. You can see in this, it is very portable, light, and compact. So this makes it very easy for the patient to carry this device anywhere that they go. This is also helpful as it can give us multiple doses and hence is convenient. It also has a short treatment time and reproducible emitted doses, which means that every dose that comes out of this device will be the same as the previous. There is no drug preparation required. The formulation comes in the canister, which is pre-made, so the patient does not have to worry about how much of the formulation he or she has to take in. And it is difficult to contaminate as it comes in a canister which has a valve which restricts entry of any foreign particle inside it. Moving on to the disadvantages of using meter dose inhaler is that it needs a good breath and hand coordination, which means that the hand coordination along with the breath when the formulation or medication comes out of the meter dose needs to be coordinated well. Patient activation, proper inhalation pattern, and breath hold is required. Along with that, a fixed drug concentration and doses can only be given, which means in certain cases when there needs to be a mix and match of certain medications, that cannot be possible via meter dose inhalers. A lot of patients might complain of reaction to propellants, which is used in the meter dose inhaler, which helps to propel the medication out of the device. There sometimes might be foreign body aspiration from debris-filled mouthpieces in cases when the patients do not try to clean or keep the device clean after every use. So there is chance of high oropharyngeal deposition, and this happens only when the patient fails to have a good hand-breath coordination. It is difficult to determine the dose remaining in the canister without dose counter. For example, if you see this meter dose inhaler, it does not have any dose counter. So it will not tell us if there are any doses left in the canister, and so that might fail to alert the patient when he or she needs to buy a new MDI. Now, talking about types of meter dose inhaler. So there are two types of meter dose inhalers. One is conventional and the other is soft mist type. So this is the conventional meter dose inhaler. Here, if you can see, I have used the term PMDI. So P here stands for pressured, and because the mechanism behind this is we are using pressure to propel the medication out of the device. So this is conventional PMDI, whereas this one is the soft mist PMDI. So let's take a closer look at what it exactly is. Talking about conventional PMDI, so here you can see in the diagram, this is the canister which we have seen in this device here. So the canister is filled with the gas phase and the liquid phase. So gas phase are the propellants and the liquid phase is the formulation of the medication that we are going to use. This is the retaining cup, which is connected to the metering chamber, and that is connected to the actuator nozzle. So every time that you press down the canister, this actuator nozzle is going to open up and a high velocity spray of the formulation along with the propellant is seen. So the medication in this canister is only representing of 1 to 2% of the mixture emitted, and it is suspended or dissolved in the propellant mixture, as I already mentioned. The volume of the metering valve changes from 25 to 100 microliters and provides up to 50 micrograms to 5 milligrams of drug per actuation, depending on the drug formulation. So actuation, the term that I have used here, means the pushing of the canister and the letting out of the spray of medication. Talking about soft mist MDI. So soft mist MDI, instead of using propellants, uses mechanical energy in the form of tension spring to generate the soft aerosol plume. So here, if we see, this is a transparent base which can be turned around, which will apply tension to the spring which is present here. You can see in the diagram, this is the spring which will be helping us with generating mechanical energy to spring out the soft aerosol spray of the medication present in the canister through the capillary tube into the dosing chamber. Then talking about MDI formulations. So PMDI are presently used to administer beta-2 agonists, anticholinergics, combination of beta-2 agonists and anticholinergics, and corticosteroids. Usually, the particle size of any of these formulations is less than 5 micrometers, which makes the drug delivery system through this device very easy and effective. Now let us talk about the factors affecting PMDI performance and drug delivery. First is shaking the canister. So it is mandatory that any person using the PMDI should be shaking the canister thoroughly before every actuation or every spray that they take. So second is storage temperature, where we need to keep in mind that as the weather gets colder, the delivery of the drug decreases. So the right amount or the right temperature at which the formulation or the medication needs to be stored is minus 20 degrees Celsius to 20 degrees Celsius. Next is the nozzle size and cleanliness. So depending on the nozzle size, the amount of drug that is delivered out of the PMDI also varies. So smaller the nozzle, the higher chances of better deposition of the medication into the lung periphery. And talking about cleanliness, if the nozzle is not clean enough, there are high chances of foreign bodies or debris entering your lungs. Next is timing of actuation intervals. So certain times only one pump or one actuation is not enough for a patient. So whenever a patient needs to take a second actuation, it is always recommended that at least 1 minute break between the two actuations is taken. Next is priming. So priming means calibration. So whenever the metered dose inhaler is not used for a long period of time and is kept idle for, say, a long period of time, say a month or two, it is always advised that first the canister is shaken well, and then one actuation is given out in the air before you can use it on yourself. Next is characteristics of the patient. As we have already discussed, the patient needs to be in a good understanding with what the breath and hand coordination is, and what is the right positioning of the metered dose inhaler, and when is it exactly to be taken. Along with that, it is important for him or her to know what the breathing technique that is the most suitable for them will be. Ways to use the PMDI. So there are two techniques. Now, talking about ways to use the PMDI, there are two techniques which can be used by a patient. First is the open mouth technique, and second is the closed mouth technique. So first, the patient should be sitting relatively straight, or if comfortable, in a standing position. And first that we have to do is shake the canister. If need be, give a priming dose, which is spraying the first spray into the air instead of taking it in by the patient. So in the open mouth technique, what we have to do is keep a distance of around 2 fingers away from the mouth, tilt the PMDI in. So in the open mouth technique, what the patient needs to keep in mind is they have to keep a 2-finger distance between the lips and the PMDI, and tilt the device in such a way that there is maximum amount of deposition of the medication inside the lungs rather than in the oropharynx. And while keeping the mouth open, press the canister down and spray the medication. And while pressing down the canister, also take a deep breath in, which is gradual and slow. And secondly, talking about closed mouth technique, in this, the patient needs to again follow the same technique where they have to shake the canister. Along with that, if need be, give a priming dose. And after that, sit straight and make sure that they have sealed the lips around the nozzle well, so that there is no leakage of medication outside. And tilt the device along with the head if need be. And while pressing down the canister, breathe in slowly and gradually without exhaling for a minute. These are the references for today's topic. Thank you.